Howdy, this is your Houston chiropractor, Dr. Tristan Wendt, coming to you along with
Dr. V. Hong from Chicago, Illinois.
Dr. V is back for her second seminar with Dr. Johnson, doing a 3-day clinical seminar, watching Dr. Johnson and myself go through new patient interactions, return patient interactions, and as well as adjusting Dr. Johnson and I over the next 3 days here. So this is her second day of 3. I'll be getting my first ring dinger for the day here. And so Dr. V, what can you tell the YouTube audience and any other doctors out there watching this about what it's like going through those first 3 days and what it's been like here on the second portion of the visit?
So what I'm doing is the refresher course now, and it's been a few months, I can't remember, but definitely you're learning more the second time around because you're basically adding on to what you already learned the first time you come here.
You're able to absorb more of that information that we're going through.
And it's easier to absorb the information because I put it into practice when I went back home and I adjusted patients and I performed the ring dinger on patients. So now when I'm coming back for the refresher seminar, there's just a higher level of understanding now.
Yes, ma'am. Let's show them how it's done, huh?
Okay.
Actually, I'll be adjusting you today, huh?
Yes.
I started that wrong on the intro there. This is the video where I'm adjusting Dr. V. My apologies. I'll be getting mine here shortly, though, so make sure you check out that video as well. Dr. V just had a TikTok video go over 1 million views in 2 days.
I know.
She's gonna be famous here. There we go. Put it onto the pen.
This side's a tickler.
Every side's ticklish for you.
Ready? Putting a squeeze on you. Deep breaths into the nose. Lift that hip for just a second for me. Is that painful on that right side?
My hair tip's bothering me.
You can put it off to the side, you good?
That's good.
And that's all just patient preference, because none of that affects what we do here on this end.
Oh no, this thing hurts.
You
Let me
got
just
it.
take it
Hard
off.
to
Sorry.
relax it. You good? That's it on
Here,
this
it's a
side.
mess. All right.
Got it. All good to go. Nice big breath into that nose for me. Keep exhaling all the way out. Make sure you keep those teeth together for me. Big breath. Yes, ma'am. I'll wake you up bearing a cup of coffee while in the morning, huh?
Yes.
Just for comedic effect, she's still kicking. I'm not checking for upper motor neuron lesions or anything. Trying to hold on to some of these, huh?
Oh.
Oh, like crazy Houston traffic got you wired up, huh?
It's a hotel. I'm not used to the pillows.
Did you want BioPhysics adjustments as well?
Sure.
Drop to you next. I'm very fortunate that I get to come in here every week and do a 3-day seminar basically with Dr. Johnson. Constantly talking
you're so
chiropractic,
spoiled.
going over details, fine-tuning stuff. Maybe an 1/8 of an inch short on the left, and that's pushing it. Nice and smooth. Any tightness or anything there when I bring those legs up?
No.
Good. Just left this side joint first here. Get this tube down a little bit. Big breath in for me. Remember that those contact points is going to be that medial portion of that PSI is right there. And then we're driving down and away from the sacrum. And the left side of that sacrum, straight that's the eye. Middle sacrum. Right sacrum. And let all those muscles drop, drop, drop. And right this side. Making sure you have a set
Yeah, that
hold.
one felt so good.
Make sure you got that set hold too, and you don't want to bounce off of the patient because then some of that force will come back into those joints that we're trying to adjust. Big breath. you could probably notice a little bit here, but even more so in the video.
Oh, God.
As we work up the spine there, you saw my arm angle changing
God.
to match that normal lumbar lordosis there. You want to come all the way back to Houston just to get beat up, huh? Exactly even. Should be the easiest of them all, but you tell me. Almost kicking yourself in the butt there now. Those shoulders drop, drop, drop. Another big breath. Sounding off in the thoracics today for the crack addicts. Now, one more here, okay? Give me a second. Breath. Those shoulders fall there. We'll do cervical P to A adjustments here. Remember, we always start C3, C4. We never go to C1 or C2. Always want to start the mid portion of the lordosis. Driving P to A and scooping slightly up to the S. Down here at T1. Straight P to A. Get that bowling ball, all that new knowledge back up top of the shoulders. Have you go face up for me next. Make sure you're for the contacts on that zygomatics on the other side. Make sure we use the thumb pads, kind of cushion that for the patient so we're not bone on bone there. This is also not just a straight A to P, we're also lifting and scooping like that. A lot of docs will come in and push straight down, and that's not what we're doing here. Arms up the side like a big old T. Our AC joints. Start left clavicle. Driving down and away from that sternum there. And that's more so just tender because of that bone-on-bone contact there, huh? We don't have as much adipose tissues as some patients that we come in here. Ow. Feel how that thrust is lateral though, not straight into the sternum. So we're trying to get that traction between the sternocostals. There you go. Have you relax your hands on your tummy for me? One of my favorites. Oh, God. See, we all practice what we preach in here. Not only about to be here getting all the trainings for the knowledge, but also just to help with our bodies as chiropractors, because we take quite a toll working on patients all day long in here. You okay? Don't worry, they're still attached.
I've been waiting for this.
I didn't rip that leg off there, at least not yet. So we'll fix Dr. J. Shoulders on each side. That's when we're contacting that bicipital tendon there. And as I bring it back into that internally rotated position, I always make sure and take my chest and stabilize on top of the scapula. Because if you don't stabilize onto the scapula, if I take it off of there, all we're doing is moving the entire shoulder girdle superior. And all I want is that humerus to move into that glenoid fossa like that. Feel the difference between those two? Look up for me. Only next. So again, oh no, I have to do pretty broad contact here. I always bring it to tension. Try to predict me on that one, huh?
It's a bad elbow.
Let the shoulder drop, drop, drop.
Oh. You're right-handed adjuster like me, Dr. J, so that's why that right side's taking a beating over the years. Shoulder drop, drop, drop.
weight right there, kind of counter.
Ooh.
Don't worry. We'll get it. I'll catch you between bucks here, because I know you need it. Muscles straight out, drop. So you still hold those shoulders. There you go. It's almost like that video with your action getting 1 million views, huh? You stand up here with me next, Dr. V? Since you're back in Houston, you gotta shoot you again. This is, even some patients, this is their favorite part because they like the arthro bouncing up and down those muscle spindles, the relaxing that after the adjustment. That's one of the big things too, is I'm not compressing your spine here, I'm just pulling your head into a slight bit of flexion to get all these paraspinal muscles to tighten the position to bounce those focus tendons and muscle spindles. Homework. Shoulders up and back. Chin straight back. Squeeze back as far as we can, man. My spine is sounding off like over here just doing that exercise. I'm gonna need to tune up too. Relax everything in one last time. Just forwards and backwards. Just feel nice and smooth after all that today.
Oh yeah.
Alright. Well, Dr. V, this is day 2 of the second follow-up visit with Dr. Johnson for that 3-day seminar here.
Yeah.
How would you kind of compare these adjustments compared to when you came in on that first one? A little bit easier?
Oh,
Even though
yeah.
they're still kind of intense. Easier than the first time you came in and got this?
Each time you're feeling more and more, breaking through all the scar tissue, adhesions, and
And like we tell
yeah, it
patients,
feels good.
like we tell patients, really the worst part is just that compression on either sides from the pins there. But that's because you're getting twice a day for 3 days while you're in here. Our
Right.
local Houstonians who come in just for once a week for those first couple of weeks to get them stabilized, they don't have a lot of those same issues because we're spacing out the ring hangers a little bit further.
Right.
But because patients come in from out of state, out of country, we like to do as much work with them in that short period of time. So well, all of them will take the spinal health and the spinal function regaining that they're getting, as opposed to just the bruising on either side. They'll kind of suck it up for those 3 days and make sure and come in and get those adjustments. So, Dr. V, thank you so much for letting me work on you today.
Yeah, thank
I'm looking
you.
forward to my
I feel
tune-up
so
adjustment here in
good.
just a
Yeah.
second as well.
It's awesome.
This is your Houston chiropractor, Dr. Tristan Wendt, coming from Advanced Chiropractic Relief in Houston, Texas with.
And Dr. V. Hong, I'm in the Chicagoland area. You can reach me at chiropracticconnection.net. Phone number 630-613-9305. I'm in Oak Brook Terrace, Illinois, and that's about 30 minutes outside of downtown Chicago.
We'll see you guys soon.
Thank you.